With hypophosphatemia, hypo means under, phosphat refers to phosphate, and emia refers to the blood. So hypophosphatemia means having low phosphate levels in the blood, typically below 2.5 milligrams per deciliter. Now, phosphate is made up of one central phosphorus atom surrounded by 4 oxygen atoms in a tetrahedral arrangement, kind of like a mini pyramid, and has a charge of -3 and is written PO4 3-. In the body, about 85% of the phosphate is stored in the bones, where it combines with calcium to make a tough compound called hydroxyapatite, which is the stuff that makes bones hard. Of the remaining phosphate, a tiny amount is extracellular, or outside the cells, like in the blood. So this is the bit that gets measured. And the majority is intracellular, or inside cells, where it does all sorts of things. It's responsible for phosphorylation, where it binds to fats and proteins. It forms the high-energy bonds of adenosine triphosphate, or ATP, which is the most common energy currency in the cell. It's part of the DNA and RNA backbone that links individual nucleotides together. And it's also part of cellular signaling molecules like cyclic adenosine monophosphate, or CAMP. The bottom line is that phosphate's really important. Now, because most of phosphate's locked up with calcium in the bones, the levels of phosphate are heavily tied with the levels of ionized calcium in the body. If calcium levels fall, the 4 parathyroid glands buried within the thyroid gland release parathyroid hormone, which frees up both calcium and phosphate ions from the bones. It does this by stimulating osteoclasts, the cells that break down bone, to release hydrogen ions, which dissolves the hard, mineralized hydroxyapatite. As soon as the positively charged calcium and negatively charged phosphate are released from the bones, they grab onto each other again, meaning that the ionized calcium level doesn't really go up much at all. These two then make their way to the nephron of the kidney, and at this point in the proximal convoluted tubule, phosphate usually gets reabsorbed back into the blood via sodium phosphate cotransporters. It turns out, though, that parathyroid hormone also shuts this down. So this means that phosphate's left in the lumen and eventually gets sent out in the urine. Now, that calcium's still in the lumen, but parathyroid hormone also affects the distal convoluted tubule and increases calcium reabsorption. So when the dust settles, as a result of parathyroid hormone, phosphate's lost in the urine while ionized calcium is kept in the blood. So ionized calcium levels rise and phosphate levels fall. With all this in mind, hypophosphatemia can develop in a few ways. The first possibility is by having excess losses of phosphate. This can result in conditions like primary hyperparathyroidism, which results in too much parathyroid hormone, which leads to excess phosphate being excreted in the urine. Another example is Fanconi syndrome, which is where the proximal convoluted tubule essentially loses its capacity to reabsorb a variety of solutes, including phosphate, which once again lets it get excreted in the urine. Another possibility is not absorbing enough through the gastrointestinal tract, because usually phosphate ions are absorbed in the GI tract, but some substances like alcohol or a medication can impair the phosphate absorption, which means it gets excreted instead. This includes antacids that contain aluminum, calcium, or magnesium, all of which are positive ions that can bind with the negatively charged phosphate and block absorption. Alternatively, a person might simply not be getting enough phosphate in the diet, although this is unusual because it's found in a lot of foods. The exception, though, is someone that's starving and severely malnourished, or someone who's actively depriving themselves of food, like in anorexia nervosa. In both of these situations, blood glucose levels are low, and as a result, cellular metabolism slows down considerably. When an individual in this state starts to suddenly eat healthy meals again, like in a hospital setting, then they all of a sudden get a bunch of glucose in their blood. And in response, insulin usually skyrockets in order to push that newfound glucose into the cells. This causes a demand for phosphate in cells because the first step in glucose metabolism is to have the enzyme hexokinase attach phosphate to glucose. Also, production of ATP molecules themselves requires a lot of phosphate. Now, this means that phosphate gets extracted from the blood, which causes phosphate levels, which have stayed relatively normal up until this point, to plummet. This is called refeeding syndrome, and it can cause levels of other electrolytes to rapidly change as well, putting these people at serious risk of developing cardiac arrhythmias and neurologic problems. Similarly, in diabetes, individuals can't make enough insulin, so the cells are effectively starving, even though they're surrounded by glucose in the blood. Sometimes these individuals can develop diabetic ketoacidosis, and to treat that complication, individuals are given insulin. And just like before, insulin causes the cells to extract glucose and phosphate from the blood, and the blood phosphate levels can quickly fall. A final cause of hypophosphatemia is respiratory alkalosis, because it causes extracellular carbon dioxide levels to decrease as it gets ventilated out of the lungs. This causes intracellular carbon dioxide to freely diffuse out of the cell, which raises the cellular pH, which stimulates glycolysis, a metabolic process that requires a lot of phosphate. Similar to the process in refeeding syndrome, when cells need phosphate, they simply pull it out of the blood, causing hypophosphatemia. Most people with mild hypophosphatemia have no symptoms, but severe hypophosphatemia can cause muscle weakness, weak bones or osteomalacia, and rhabdomyolysis, which is a type of kidney damage due to muscle breakdown, as well as an altered mental status. In addition, hypophosphatemia that happens due to primary hyperparathyroidism might show symptoms caused by the associated hypercalcemia. A common mnemonic to remember these symptoms is stones, thrones, bones, groans, and psychiatric overtones. Stones is for calcium-based kidney stones or gallstones that can form. Thrones refers to the toilet to remind you of polyuria or frequent urination that results from impaired sodium and water reabsorption. Bones is for bone pain that results after chronic hormone-driven demineralization in order to release calcium. Groans is for constipation and muscle weakness, both of which are partly due to decreased muscle contractions. And finally, psychiatric overtones refers to symptoms like depressed mood and confusion. Diagnosis of hypophosphatemia is based on the phosphate levels being below 2.5 milligrams per deciliter, and treatment involves giving intravenous or oral phosphate and close monitoring of the blood levels. In cases of malnutrition, it's important to gradually increase caloric intake and supplements over several days to avoid refeeding syndrome. Alright, as a quick recap, hypophosphatemia describes a blood phosphate level below 2.5 milligrams per deciliter, which can result from increased excretion, decreased absorption and intake, or a shift of phosphate from the bloodstream to the inside of cells. Regardless of the cause, the treatment is typically a slow increase in phosphate levels to bring them back to normal again. What's up, guys? Thanks for watching. That was hypophosphatemia, which is sort of like the sister video to hyperphosphatemia. We're almost done with all these renal videos, which is really exciting. I think we only have hypo and hypernatremia left, which is low and high sodium in the blood. So definitely be on the lookout for those ones in the coming weeks. This particular video is written by Charles B. Davis and edited by Rishi. I did the voiceover and the illustration, and Sam, which is one of our new video editors, did the video editing. So nice job, everyone. I think it turned out really well. If you guys are interested in learning a little more about this topic, you should definitely head over to osmosis.org, where we have a ton of quiz questions and flashcards and other sweet resources to take advantage of and just sort of learn some more stuff. So if you're interested, go over there and make an account. Otherwise, you can always support us by donating on Patreon and subscribing to our channel and following us on social media. All right, guys, see you later.